Good afternoon, and thank you for joining me for this session on the intersection of health and housing. I'm Steve Guggenmoss, Vice President of Multifamily Research and Modeling at Freddie Mac. The intersection of health and housing has become more immediate to all of us in the past 18 to 24 months. In this session, we'll take a deeper dive into the topic as it relates to rural communities. At Freddie Mac, as we execute on our mission to make home possible for all, we know that a stable home is important for many reasons, and a piece of that is driven by a concern for the health and wellness of the communities and people that we serve. As the title of this session suggests, we'll hear from Liz Dobis, Lance George, and Sarah Burke on topics related to COVID-19, housing, and the connection to both physical and mental health. Liz Dobis will kick it off for us with a talk on the progression of the pandemic in metro versus non-metro areas. She'll also discuss the economic implications. Liz Dobis is an economist and a regional scientist in the Resource and Rural Economics Division at the U.S. Department of Agriculture. And with that, Liz, the floor is yours.
Thanks, Steve. As Steve mentioned, my name is Elizabeth Dobis. I am a research agricultural economist at the USDA Economic Research Service, and I specialize in rural health. And today I'm going to be speaking with you about COVID-19 in rural America. So as you may be aware, there are approximately 4 distinct surges in COVID-19 throughout the pandemic. The first surge occurred measuring from trough to trough from approximately early March to mid-June 2020. That led straight into the second surge, which went to about mid-September 2020. And then the third surge was the longest surge, occurring from mid-September 2020 to late June 2021. And we're currently in a fourth surge, which started in late June 2021 with the emergence of the Delta variant and is proceeding into the present. Now, there is spatial variation in the COVID-19 cases and deaths throughout the pandemic. Those surges did not affect all of the country the exact same way. And so we find when we look at regions and urban-rural categories that the predominant region or urban-rural category varies across surges. And so we're going to be looking at this and illustrating this through the COVID-19 deaths, because when we're looking at health, when we're looking at the well-being of the rural population, it's the deaths that ultimately tell us the fate of anybody who is infected. So this is the first slide that I'm going to be showing you to illustrate these deaths. It is the 3-week moving average of weekly deaths from COVID-19 per 100,000 adults. This is by urban-rural category from March 15th, 2020 to October 3rd, 2021. Now you're going to see 5 categories on here. 2 of these categories are related to urban counties, and 3 of these categories are related to rural counties. Large metropolitan counties that are part of our large metropolitan area of at least 1 million people or more are shown in red. Then we have small metropolitan counties. These are counties that are part of a metropolitan area with between 50,000 and 1 million people. These are shown in gold. And then our 3 rural counties start with our micropolitan counties that have an urban area of at least 10,000 people up to 50,000 people. These are shown in gray. In blue are our small town counties. These counties have an urban area of 2,500 people up to the 10,000 threshold. And then our green counties are the most rural counties, and these don't have an urban area of 2,500 people or more. Now, when we start looking at the different surges, you can see the ups and downs of the different surges. So that first surge occurred primarily in the large urban areas. The second surge was more evenly spread out throughout the entire urban-rural continuum, but we do see that rural areas, which were lagging behind in the first surge, really started picking up during the second surge, and then really started surging ahead of the urban areas during this third surge. You can see the surge was led by the most rural of the rural counties. And then as we go through, we can see where vaccinations started occurring. We can see that there was a rather precipitous decline during that third surge in February and March before it sort of plateaued, and then troughed down in mid-July, and then it again increased with the fourth surge being led by all of the non-metro counties kind of in succession. When we split this up by regions, we have 4 distinct regions in the United States. The Midwest is shown in red, the Northeast in blue, the South in green, and the West in purple. And so what we can see here is a large spike or a large amount of deaths in the Northeast during that first surge. We can see that the second surge was primarily felt in the West and in the South. And that third surge actually was led by the Midwest, and it peaked in the Midwest approximately a month before in the rest of the country. And the final surge we're seeing is being led by counties in the southern part of the United States. So we've talked a little bit about what part the spatial variation in COVID surges and COVID cases and COVID deaths. And what we're really interested is why are we seeing this spatial variation? What aspects of these locations could be affecting that variation? So the first thing that I wanted to look at, since this is a rural housing symposium hosted by Freddie Mac, is high housing costs. And this is because high housing costs and COVID-related financial hardship may affect personal well-being. Here I'm in this table, I'm looking at housing cost burden, which means that a household spends 30% or more of their annual income on their housing. And I've broken this up by low income households, moderate income households, and high income households, where the threshold between low and moderate is $20,000 a year, and the threshold between moderate and high is $50,000 a year. To kind of see if there's any relationship between our classifications of between the housing burden and COVID, I've also looked at COVID cases per 100,000 residents, deaths per 100,000 residents, and deaths per 100 cases as kind of a measure of the severity of COVID in these different urban-rural classifications and census regions. The bold in these charts indicate the highest number, or the maximum, across the row. And what we're seeing is that we're not really seeing the bolded numbers line up between the housing cost burden and the COVID-19 numbers, indicating that there's not a clear connection between the housing cost burden and the COVID-19 cases and deaths. So in fact, we need to look to other factors to help explain these trends. So here I have a slide discussing cases, factors affecting cases and deaths from COVID-19, because the things that affect cases and deaths are a little bit different. You will notice that a few of these concepts are in orange, and these are the things that I felt were a little more related to housing, just to sort of highlight them a little bit more. But we'll just go ahead and talk a little bit about transmission factors for cases first. So you would expect to see more cases in a location that's more connected with other parts of the country. So when we first had COVID-19, it spread, it was spread. It wasn't in every location at the same time, so it needed to be spread between locations. So the more connectivity there were between locations or among locations, the larger chance it was being transmitted between those locations. Another thing is, because COVID is spread through the air, if you've got crowded living conditions, crowded working conditions, or if you come into contact with a lot of people in those living and working conditions, you can have more transmission in those types of areas. And those are covered under residential crowding and crowded job conditions. And additionally, actually, the inability to reduce interpersonal contact, because if you don't have internet access, you can't order things online and have them delivered to your house. You have to go out into the community, pick up food, pick up whatever necessities you need for your house and for the people living in them. The other thing is poor hygienic conditions. If you don't have running water, if your house is not as clean as if you're not cleaning your hands when you're coming in from outside, poor hygienic conditions can affect transmission as well. And finally, the vaccination rate. If you've got a higher proportion of the population that is vaccinated, they'll be less likely to actually get COVID. And if you have fewer people with COVID, it's more difficult to spread it. There are also behavioral factors associated with the number of cases in a location, and these are related to race, ethnicity, educational attainment, and other personal characteristics of the people living in a location. Now, you can't die from COVID if you don't have a case of COVID, right? But once you have a case, whether you pass away from that infection is affected both by the severity of the infection and your access to medical care. So things that affect the severity of the infection and can be related to things such as the population health, the natural cause mortality. Are people generally healthier in that location or not? Do you have an older population? Are the people in a location largely uninsured? What's their access to medical care? Is there a lot of poverty or lower incomes in the area? Because that can be limiting in terms of accessing care. And then sometimes there are things related to race, ethnicity, beliefs that will affect whether they're willing to seek care, or there might be things specific to those particular communities that would affect the severity of the infection or the access to care. Additionally, vaccinated people are less likely to have a severe infection. And if there are fewer cases in a location, you're less likely to contract it. So then you're not going to die if you haven't contracted it, right? And then locationally, it's important to take a look at the distance to the medical facilities and care, and make sure that you have sufficient staff. So if you've got insufficient medical facilities and insufficient staff, you can't get the care that you need if you do have a severe infection, and you would be more likely to pass away. So these are the things that would influence the death rate in a location. So what we're finding here is that rural-urban population differences and vulnerability to severe illness and death from COVID-19 do help explain some of these trends. And so I've got some information on health vulnerability factors to COVID-19. Now, these are looking at the proportion of the population in counties that have that are considered to be vulnerable. They're in the top 20% as defined by each source of vulnerability. And what we're finding is that there are larger shares of rural residents than urban ones in these high vulnerability counties, which could help explain some of the higher death rates that we're seeing in rural areas later on in the third and fourth surges once the COVID made it to those parts of the country. We're also seeing that the share of fully vaccinated people is lower in non-metro areas, and that as of October 3rd, 2021, non-metro areas were at 42% fully vaccinated, while metro areas were at 53% fully vaccinated. So overall, we find that the prominent region or urban-rural category varies across surges, and this illustrates the spatial variation in COVID cases and deaths throughout the pandemic. Second, while high housing costs and COVID-related financial hardship may affect personal well-being, there's not really a clear connection between housing cost burden and COVID-19 cases and deaths. And finally, behavioral, population, and location factors are correlated with COVID-19 case and death rates and help explain these trends and surges. So thank you very much for your attention, and I'll go ahead and send it back to Steve.
Thank you, Liz. That was a compelling presentation. Clearly, rural America was particularly impacted by the pandemic because of an existing health gap and persistent poverty. Liz's work ties nicely to the next presentation from Lance George. Lance explores how the pandemic has imposed additional financial hardships which have not been realized equally across the population. Lance is Director of Research and Information at the Housing Assistance Council. I'll now hand it over to you, Lance.
Thanks, Steve. And first and foremost, we would like to thank Freddie Mac for once again hosting this important discussion and symposium over the next couple of days. I know I'm really looking forward to the conversation and the research. For the past 50 years, the Housing Assistance Council has helped build rural homes and communities across the nation. And we've done that through an array of activities and resources. But one of those is, and that goes back to our founding, is providing data, research, and information that we like to say help inform strategies and solutions. So we're really pleased that Freddie Mac is holding this discussion, because data is absolutely essential and important to developing those strategies and solutions. And so we look forward again to the discussion, but we also want to note that we think this is a longer term process, and we hope there's more commitment and support to rural communities. It's really nice and refreshing to have, not just be the rural panel, but to have a couple of days dedicated to rural discussion. But we also we hope that there'll be some continuity going forward in helping address these strategies and solutions that are needed in rural communities. So I would say, before we start the discussion, if you asked me in March of 2020 or before then, what the 3 or 4, and you didn't have to ask me, I kind of went around saying this, what the 2 or 3 most important housing issues were in rural communities, they would be notably the affordability crisis, which many thought was only happening in urban communities or urban and suburban communities. The alarming rate of loss of affordable rental housing in many rural communities, and the economic viability or distress in some rural communities related to the demographics. You had kind of a vitality and a vibrance issue that was also manifesting itself in the housing provision in rural communities. So obviously the world changed in March of 2020, and this issue inserted itself maybe on top of those 3 or 4 issues in rural communities. And in some ways, they all cross-pollinate, right? In some respects, it's probably exacerbated or accelerated some of those issues. But we at the Housing Assistance Council have recognized that this is an important issue, and it's something that we want to track and acknowledge. So we appreciate this opportunity to present, kind of a couple of perspectives, and one of which is just to reiterate what has happened with COVID-19 in rural communities and how that might have impacted what we would call downstream impacts or downstream effects of the virus to the rural economies, and notably to housing. We have relatively limited time today, so we're going to focus on one specific element. And we do hope the conversation, therefore, goes from, how do we use this information to inform those strategies and solutions that I mentioned before. I would like to acknowledge someone that you've already heard from today, my colleague, Keith Wiley. He's the senior researcher at the Housing Assistance Council, and his amazing data skills and research capabilities have really underpinned most of this research, and a lot of this work is his. So really want to highlight Keith's work, and I know that he did a great job earlier on discussing some other research that we're conducting in this space. So I know that Liz had a much more in-depth discussion on COVID-19 in rural communities, but we also at the Housing Assistance Council track it, and wanted to just reiterate the importance of that before we got into those downstream impacts of affordable housing from COVID-19. And, just a clear kind of designation that COVID has had an unfair and uneven progression across rural America. In some perspectives, rural communities have simultaneously the highest and lowest rates of COVID-19. And that makes it unique, and it's had a different progression or manifestation across rural communities. So this is simply a chart very similar to some of Liz's graphics and dynamics on COVID-19. But these are the new cases per day since February 20th of 2020. And that's when the Housing Assistance Council, the data that we have, acknowledges there was the first reported case of COVID-19 outside of metropolitan areas. And you'll see, again, a slight different manifestation. But in that time period, we've seen, over 6.9 million reported cases, and, a large number, more than 123,000 associated deaths. And those numbers are going to continue to increase, unfortunately. But again, there were some minor different manifestations. We didn't have the same initial, we talk about these phases or waves, maybe not the initial wave, but most importantly, the last wave, the Delta variant, which has impacted rural communities much more, particularly so in deaths, which is the next chart that shows the reported deaths per day. And by all accounts, those were much higher in rural communities than not. So again, a different progression, a different manifestation. But one element that we wanted to show, which I think is important in almost any analysis of rural communities, is simply the geography. The geography is important in rural analyses. They're just different spatial dynamics in rural communities. We have a relatively large landmass and relatively few people. And I think that makes for different dynamics. In some respects, some rural conditions are no different, but in this, I think it's very different. And we often need to acknowledge geography. So what we want to do is give a geographic distribution or an illustration of how COVID progressed through rural America over the last 14 to 12 months. So this map illustrates what we would call hotspots, which are cases per 100,000, and the darker colors indicate a higher level of hotspot or higher rate of case per 100,000. The darkest color would be the rate of more than 100 per 100,000 cases. And this was in May of 2020. So you just see that you have some hotspots. Oftentimes these were located in what we would call some individual communities, oftentimes meat processing plants or correctional facilities. And then you see just a progression. We go through June. I'm going to roll through these relatively quickly just to illustrate a point about the evolution of the virus. Then July of 2020, where we see a greater concentration in the Southeast. Then August of 2020, September, October, November, December, getting into 2021, January, February, March, April, May, June, where we see even the nadir of the viruses, and then we start to see the resurgence of Delta in July, August, September, and the most recent data as of October 20th, 2021, following that every 20th day of the month, starting from the beginning in February of 2020. And I illustrate this point to note that the virus has, to some degree, and this is not a technical term, but is pinballed around. And maybe that's because I'm old enough to actually play pinball on a pinball machine. But it has had you'll notice some churn where it kind of regionally churns around the nation. I think that's important to note in the rural context, that it's not all one place at one time. It's had this geographic churning across the nation. And I think that's important because it does kind of flare up and then it evolves around. And I just want to highlight that geographic element of the virus, and that's some of the work that we've compiled or conducted. We wanted to turn to how has COVID impacted housing provision in rural communities. And again, we wish we had more data to talk about a whole range of aspects in this, but we wanted to focus, again, with the limited time that we had today, on some recent research that we've been conducting. It's very preliminary, very descriptive, but looks at mortgage dynamics and home purchases. So, in that larger encapsulation, we would still say under a larger rubric that the rural housing ecosystem is still uncertain. There's still a lot of kind of what we would call known unknowns, but we are working towards understanding some of the maybe more known knowns. Looking at the mortgage dynamics over the last, how mortgage dynamics have been impacted by COVID-19, there was a narrative that because of workplace dynamics and changes in our basically demographics and changes mostly in kind of the workplace, that there were various communities that were kind of churning or growing, and there was a lot of migration in certain communities. And we wanted to look at the mortgage aspect of that. I think there's, the jury is still out and it's still very new, and we don't really know exactly entirely what's happening, but this is a quick look into some of those mortgage dynamics. And the first slide just simply shows home mortgage loan originations prior to COVID-19. So this is a 15-year look, and you'll see a couple of dynamics. First of which is the orange bar at the bottom are the rural mortgage originations from 2005 to 2019. The yellow bar in the middle are suburban loans, and the lighter orange bar are urban mortgage originations. And you see a couple of things here. First, you see the dramatic decline and then the gradual recovery from the 2008 housing recovery. And then notably that the rural pattern or trend was somewhat similar to the urban and suburban and the national trend, but was relatively modest in size compared to the overall originations, hovering somewhere between 13 and 15% of originations over that course of about 15 years. But to take a quicker look, I mean, a more closer look at more recent dynamics. We wanted to look at mortgage originations, notably between 2019 and 2020. This chart shows home purchase originations between 2018 and 2020. You see very similar dynamics, although there has been a continued increase in the number of home purchase originations in all three areas. But interestingly enough, proportionally, that growth was largest in rural communities. So you saw roughly a 14% increase in home purchase originations between 2019 and 2020. Similar, but somewhat smaller in suburban and urban, or suburban and ex-urban communities, about 11%, and then smaller in urban communities. Very quickly, we wanted to take a look at refinances because that was refinancings. That was a large issue in the mortgage dynamics, kind of accelerated by low interest rates. And we did see dramatic increases in all areas for refinance mortgage loans in that time period, to the point where it was extremely large, about 131% increase in refinancings between 2019 and 2020, although still not as large as in suburban and urban communities for rural communities. So to get back to that dynamic of geography, and geography is important, we quickly wanted to look at a geographic illustration of where some of that home purchase activity was taking place. So this map illustrates 3 or 4 trends. The first of which, the light yellow trend, indicates communities where they had actually a decline or was stagnant in home purchase origination. So there's actually a decline. The middle orange was where there was 0 or 1 to 24% increase, a kind of a modest increase. And the third area is where you had the darker red areas indicate there was more than a 25% increase in home purchase originations. Now, I'm someone who kind of pores over maps all the time. I'm not a geographer, but I would say this is, to some degree, what you call a random pattern, especially looking at the increase, the dramatic increase. There's some general patterns, but it doesn't seem to be any specific regional geographic pattern. So we wanted to look at that a little closer, and we married these data with USDA Economic Research Services county typologies, which is really an indicator of the primary or dominant industry in many of these communities. And you'll have an example there of kind of farming communities, mining communities, government communities, recreation, retirement, amenity communities, and then some that are non-specialized. So this is pretty basic, and it's somewhat preliminary, but we looked at the concentration of the activity by the increase in loans. So those communities that had a decline in loan is something that you might expect. We saw a greater concentration of those communities were either farming, mining, or manufacturing communities. In the middle, you saw a somewhat equal distribution among the ERS county typologies, but in the communities that had a high concentration of mortgage originations between 2019 and 2020, there was a trend that you might expect, but was interesting. We saw a relatively modest number of those communities were actually recreation-based communities or retirement-based communities. So that follows some of the narrative that some of those trends were communities that were relatively close, that saw kind of rural communities that saw increases in population and housing activity, were either close to metropolitan areas or communities that had amenities. This doesn't corroborate that in any way, but it is an interesting indication when we kind of married the data and looked at specifically at what communities were experiencing greater increases in their mortgage activity. Just very quickly looking at a couple of dynamics. Consistent with some of those communities, we were able to look at what was the median loan amount, and there was a higher loan amount in the recreation and retirement communities than overall rural communities. So it was above $200,000 for the median loan amount in recreation communities and very close to that in retirement communities. Similarly, you saw higher incomes among the borrowers in those areas that had a greater increase. So a median income, again, in the recreation communities of the borrower of above $90,000, a very similar rate in the retirement communities, which tended to be the more amenity-driven communities and also had those greatest increases. So again, these aren't dramatic findings, but they do allude to that there was some greater increase, potentially greater increase in more amenity-based communities in rural areas in terms of mortgage dynamics and mortgage originations, but we're really interested to kind of follow this. I'm more interested in the trends as opposed to a one year total. And in closing, I just would like to note candidly that we really wish we could look at the larger ecosystem. We really only talked about, and we should really just scratch the surface of mortgage originations. And we really want to look at, in some respects, that's the success story, right? Households that were able to obtain new home ownership or a mortgage. We are deeply concerned at the Housing Assistance Council about some elements distress related to the pandemic and how it might manifest itself in housing markets and communities. And notably, I would just kind of close on this point that renters, while we don't have great data, remain the most at risk in rural communities. They have lower incomes, less wealth, less savings, fewer housing protections, and are more likely to have, their jobs be economically impacted by COVID or work in perilous or dangerous conditions. And in the rural context, there's just a dearth of good quality rental housing in many communities, which exacerbates or accelerates some of those issues, trends, and conditions. So we really want to focus on that, and that's where we think we need additional support. Where do we go from here? We really want to kind of continue this work. I think we are really at an early stage, and we need to understand what's going on. We just don't know. We are still in a kind of a known unknown. We know there are a lot of dynamics out there, but this could manifest itself, if not over months, over years. So we still need to stay cognizant and pay attention to this issue. And we hope there are continued resources to do that, candidly. That's what we need, is to maintain a focus and maintain attention and resources to this particular issue. Thank you very much. I will close in noting that we at HAC continually track the coronavirus and its impact to rural communities, and notably those downstream impacts to the economics and housing elements of the community. And we also, I just wanted to highlight, we recently published our Rural Voices, our recent edition of our quarterly magazine, entitled Rural Voices. And this particular edition focuses on what we call the new normal. And it has a lot of we provided a few data points here today, but we also have a lot of great qualitative research and information and stories from housing practitioners and experts about how COVID-19 is impacting rural markets and rural dynamics from, again, that perspective, practitioners and experts. So we encourage you all go to www.ruralhome.org and check out that edition of Rural Voices magazine, which I think is a great complement to this research. Once again, thank you, and I'll turn it back over to Steve. We look forward to the discussion today and tomorrow.
Thank you, Lance. COVID certainly has had a disproportionate impact on marginalized rural communities. While the ramifications of the pandemic are still playing out, the strategies you've discussed could be helpful. This brings us to our last presentation, led by Sarah Burke. Sarah is a market research professional here at Freddie Mac. She'll share insights and statistics about survey work on the impact of housing to health that Freddie Mac's Market Insights team conducted. I'll now yield the floor to you, Sarah.
Thanks, Steve. Hi, everyone. I'm Sarah Burke from Freddie Mac's Market Insights team, and I'll be talking with you about one of our most recent studies, which explores the intersection of health and housing. Today, we'll focus specifically on how housing is impacting the health and well-being of rural renters and owners. Our team conducted this study in August to better understand how the places we live are impacting our health. Prior to this study, we had conducted research to determine how public health within the context of the pandemic may be impacting the housing market. The purpose of this study was to flip that focus and instead explore how the housing market may be impacting the health of Americans. We know that Americans spend more time in their homes than anywhere else. From this study, we saw that on average, about half of Americans spend 15 hours a day or more within their home. So at a time in our lives when we're thinking about the impacts of our surroundings in new ways, we are curious to learn how Americans think about the impact of the place where they spend the most time. To do this, we interviewed about 2,000 millennials and Gen Xers. A quarter of those respondents were identified as rural respondents, and those are the results that we'll focus on today. Narrowing in on our rural population, 54% identified as homeowners. Another 34% identified as renters. The following slides will compare these populations to each other, as well as to the total American homeowner and renter populations. In order to do this, we've structured our analysis to explore the impact of housing on three main areas: affordability, home features, and surrounding neighborhoods. For affordability, we're looking not only at the cost of housing, like housing payments and repairs, but also the bigger picture of overall household finances, which is known to impact stress level. For home features, we explore which elements within personal homes Americans think have positive or negative impacts on their health, including air quality and privacy levels. And for neighborhoods, we focus on nearby spaces that are known to impact overall health, like grocery stores and public parks, including the quality and the accessibility of these spaces. We also explore the sense of community and belonging that respondents feel within their neighborhoods. So to begin, we'll start with some of the perceptions that Americans have about the relationship between their health and their housing. For the most part, respondents said that they are in good to excellent physical health and that they experience at least some level of stress. This slide here is looking at all Americans, so combined rural, suburban, and urban respondents. Overwhelmingly, respondents feel that their housing is impacting both their physical health and their stress to some extent, with 84% and 83% reporting there is an impact there. If we look at this same information among rural residents, we start to see an interesting story emerge, particularly among rural renters. What's interesting about these numbers isn't so much that there is a difference between rural owners and renters. We see that overall, homeowners are more likely to say that they're in good or better physical health, and renters are more likely to say that they're stressed. We also see that as a whole, rural residents are less likely to report they're in good or better physical health than total Americans are. However, it is interesting to see the degree to which rural renters and owners differ in thinking about the impact of their housing. If we look at the rural renters here, this group has a noticeably low perception of their physical health and high perception of the impact of housing on both physical health and stress level. Only 47% classify themselves as having good or better physical health, with more than half saying that they're in fair to poor health. If we look at how rural renters are perceiving the connection between their health and housing, they indicate a really high level of impact, particularly as compared to the rural homeowners. 89% believe that housing impacts their physical health, and 90% believe that it impacts their stress level. So those who are renting in rural areas are an important population to learn from, because we're seeing concerning health outcomes, as well as a strong belief that housing has an impact on those health outcomes. To break down those perceptions, this slide looks at how total Americans think about the impacts of the three focus areas on their overall health. So this is inclusive of both physical health and stress here. We see that costs related to housing were most likely to be seen as causing a negative impact on health, while neighborhoods and home features were largely seen as having positive impacts. Interestingly, 40% of all respondents ranked rural areas as the healthiest area to live, above suburban and urban areas. Not too surprisingly, people tended to lean towards their current environment type as being the healthier option. So despite reporting lower overall health concerns on the previous slide, 72% of current rural residents selected rural areas as the healthiest area to live. Looking at this same data for just rural residents, rural renters pop out as being more critical of the impact of home features in neighborhoods on their health. The bars on the left here are looking at just those who noted a negative impact. So you can see that rural renters are significantly above rural owners. Given those negative perceptions among rural renters, the right side of the slide compares how rural renters and total American renters value their homes. rural renters are less likely to feel that their home provides a sense of safety and security. They're also less likely to agree that their home has always been important to them and to say that their home has become more important to them since the pandemic began. So while we would expect to see the renting and owning populations differ from each other, it's also helpful to note that we see the rural renting population differing from the total renting population. So given how these general perceptions around health and housing are linked, we're going to explore how rural residents responded to themes of affordability, home features, and neighborhoods. And the first area we'll look at here is affordability. While rural Americans do tend to have lower housing costs than suburban and urban residents, the overall state of their household finances is an important factor in both affording those housing costs as well as other essential living expenses. The green portion here is representing the percentage of rural renters and owners who have enough money to go beyond each payday. This would mean that they have money to put into savings or spend on things that they want but may not need. The blue categories are where we want to focus. These represent those who either do not have enough money for the basics or are living payday to payday with just enough to get by. Rural residents are more likely than the average American to fall into these blue categories, where they may be experiencing financial strain or higher levels of stress in order to pay their housing costs and other essential expenses. Rural renters are particularly vulnerable here. 77% are reporting they have not enough or just enough money to get by. And the second area we can look at is home features. Here you're seeing the features that rural Americans say were most likely to negatively impact their health. For both renters and owners, we see that pests, mold and bacteria, ventilation and air quality, and dilapidated features are top concerns. Rural renters report that water quality may be a major concern, and homeowners say that privacy levels are negatively impacting their health. In general, rural residents are more likely to rate their home as a lower quality than total Americans. 89% of rural owners say that their home is of good to excellent quality, compared to far fewer rural renters who come in at 62%. And our third area of focus is neighborhoods. Similar to how respondents rank the quality of their personal home, they also rank the quality of their surrounding neighborhood. 90% of rural owners say the quality of their neighborhood is good or better, compared to a much lower 67% of rural renters. Again, we see that it's typical owners are more likely to report high-quality neighborhoods than renters, but because that rural renter number is so low, the bars on the right dig into how rural renters compare to total renters. Drug use and access to good jobs emerge as top community concerns among rural renters to a higher extent than total renters. We also see that access to quality healthcare and access to healthy, affordable foods are top community concerns. These community problems, of course, differ between neighborhood type, so things like traffic and noise pollution won't be as highly seen here with rural renters as they would be with urban renters. But overall, a really interesting view of what is uniquely impacting each community type. And within the context of that neighborhood rating, respondents rated the quality of local spaces that have been linked to community health. You can see that for every neighborhood space here, rural owners and renters are less likely to give high quality ratings than the total American populations, including for grocery stores, schools, parks, sidewalks, and hospitals. So this is a really clear view of how surrounding communities are impacting health outcomes differently, even between rural renters and owners, as you see here. And finally, existing research shows us that health outcomes are linked to feelings of social cohesion within a community. Again, I'll call your attention to the rural renting population. This population reports comparatively low feelings of social cohesion, both in reporting good relationships with neighbors and in feeling a sense of belonging within their community. Again, this research speaks to the many ways in which our homes are impacting our health. We see that affordability, home features, and neighborhoods are important areas to focus our attention. Of course, there are several populations beyond the rural renting and owning populations who are important to learn from, but we do hope that this examination of the rural community is helpful in better understanding how the places we live play a critical role in determining our health outcomes. Thank you, and I'll send it back to Steve.
Great. Thank you, Sarah. And I want to remind everybody that now is the time that you can communicate your questions to us. And there's so many great things to cover. In today's session, we were fortunate to get a lot of great background on rural health, on rural community characteristics and the needs in them, and at the end here on the perceptions of people living in rural areas. And so I think, circling back a little bit to what Sarah just said, I think it's really important that we've learned about the insights of how housing affects rural folks, both their physical needs and their mental health. And that their survey also notes meaningful differences. Sometimes in surveys it can be hard to see differences, but between renters and owners in rural areas. So definitely these are two different populations, and I think definitely got highlighted well, and I hope that there's some questions about that. And I think the presentations overall reiterate how housing and health are both essential aspects of people's lives, and they can be impactful to renters in rural areas. And each of the presenters provided us with a perspective on that today. As Lance said so well, there were many affordability and other issues leading into the pandemic. Those issues have been amplified during the health crisis. And we've seen that there are issues that are unique to rural areas, and that the severity of the pandemic geographically changed over time. And that as rural areas have been hit hard, we really need some time and focus on those things. And I think that Liz did a great job of capturing that while at a base level, affordability measured by AMI doesn't connect exactly to the effects, but things like overcrowding certainly do. And again, circling back to Sarah's work, just the idea that more and more households in rural areas are living paycheck to paycheck or even worse, and that would have an effect on them, that they have lower perceptions as it relates to good health, that they have experienced more stress, and that they feel like housing is an important part of that, are all things that I think are worthy of discussion. And I think that having a light shine on those today has been important. So with that, we'll turn it over to some questions. So I'm first going to turn to Liz, and I've got a question that there's so many things that can potentially be approached, but in a situation where homes are where they are and medical facilities are where they are, and we can't really bring those two things together. And certainly we've heard about ICUs being further away, that they have they're in a situation where they fill up these rural areas. What do rural areas do when they have these issues of people needing further to go to get the appropriate health care?
Well, thanks, Steve. So there's actually no one-size-fits-all solution for rural areas, because each rural area is unique to what resources they have available, the group of people living in that area, whether you have a lot of people with underlying health conditions, a lot of older Americans. All those things can affect the amount of healthcare that's needed. We're still sort of studying what would affect that lack of healthcare or decreasing healthcare in those areas can have on people living in those areas. There are several federal programs that are in place to try and help keep health centers open in rural areas, such as critical access hospitals. federally qualified health centers, those types of things are trying to help keep those more rural locations solvent, so it's easier for people living in rural areas to get access. Another thing that has come into big play, particularly with COVID, is telehealth. Being able to access some very basic care via the internet, and it works particularly well if you don't necessarily need to go in for any labs or anything like that. But to have telehealth, you also need internet access. So, that can also be a barrier to places in the rural communities that don't have access to that health, to the internet. So, it's a really difficult question to really answer, but I guess the gist of it is that you have to try and figure out what's going on in the community and what resources are available to try and improve access to healthcare in that community.
That to me, that raises the kind of the intersection of multiple issues where sometimes we talk about the availability of internet. So if you're going to get healthcare virtually, then you need very good connections. And so I think that raises those issues, and it also identifies how complex these things can be. Circling back over to the housing market, and I'll go to Lance for this one. I think that there's been a lot of press during the pandemic, and people get noticed from kind of a high level of people, pulling out of urban areas or as work from home becomes more possible, and will it kind of continue into the future? That's created a possibility where people move to places where they previously could not to get the kind of work that they want to do. And now, post-pandemic, the questions are still out there. But we certainly do see people moving more to rural areas, and I think that the stats that you had showed that the pickup in rural areas has certainly been strong. And so, to the extent that that pushes prices up and that makes affordability more challenging, then that really puts those rural areas in a tough spot. So, because something that was already not affordable is going up in price again. So, Lance, what can be done on that issue?
Well, thanks, Steve. I would have to say, on that issue, that large question of was there this great rural return after the pandemic or during the pandemic, I just don't know if we have good enough data. There are some indications, like in our research, very preliminary, very small indications. For example, one data point that there was increased mortgage activity in certain rural communities. But I'm someone who, at least in the footnotes, have a lot of asterisks and a lot of caveats, and I think it's still really early. It's just too early. And I come back to this larger rural dynamic that I mentioned before, that rural America is really big, and it's really diverse. It's not monolithic. So when we noted in that map of some areas of increased mortgage activity, it was somewhat random. We did see possibly some indications of higher mortgage activity in certain communities, those with more amenities, maybe some of those that were closer to larger urban areas. But I do think the jury is still out, just to use a very lay common term on that. And I think we still have to assess and analyze. There's no doubt that I think some of these dynamics, as we talked about before, could exacerbate or accelerate some housing conditions in certain communities, but it's really varied. I would point to help answer this question, because I still think we just don't have enough data to know yet. I think it's something we need to continually assess. I mentioned in my presentation, in addition to all those data and slides and bombarding people with that we just produced a magazine, which I find really interesting, where we asked, it's called Creating the New Normal. We asked housing practitioners and experts how the pandemic impacted them. And what they saw going forward. I'm putting this question off on them, Steve, but I would say I encourage the participants at this session, you're obviously interested in rural issues, to go check out that edition. I think it was really a quality piece of information from people who live this every day and are on the ground. two key findings that I would say from, if you read the and this is condensing those practitioners. One is that many of those organizations and communities, and even at the household level, were buoyed by significant economic investment and stimulus and just outright protections during that time period. And that's one where I actually am a little more concerned, because some of those protections are ending. On the other side, the other dynamic, to try to get to this really complex question, is, again, it varies widely across communities, but Zaraima noted this in an earlier panel, that rural people have a lot of perseverance. They just do. They persevere, candidly, if I can make that anecdote. And you see that within many of the communities that we addressed and helped through the continuity of this pandemic, through their housing and through their business models and how they work with local community members and residents and households. And they just are incredibly resourceful. And that's where I see it's really positive that you have this local community-based community-based effort where communities, community practitioners really know what their residents need or what their communities need, and they work really hard. They have a great feel for that, and they have a lot of perseverance, and they work through these issues. So I do think really the jury is still out. We still have a long way to go to assess. We need to continually assess. We just don't know. There were a few indications in certain markets that there was some increased activity, but we at the Housing Assistance Council often worry about the other side of that dynamic, right? Communities that have struggled long before the pandemic came, and many of them are accustomed to adversity and have handled this quite well. I would, if I could maybe try to, through all of that, address your question. I know I have a researcher bias, but I do think it's incumbent upon those communities, how they can continue this growth, is to assess. I know it's difficult in all the other things that they're doing, but to undertake housing needs studies and to continually assess themselves what's going on in their community. So that's how I would broach that question, but I don't really have a good answer. Thanks.
I think that gives us a lot of great insight, Lance. I think that the idea of involving local folks, right, and oftentimes they do know what they need, but also kind of doing studies and preparing for those eventualities certainly is important. Another question I want to that I had that I want to kind of circle back to is from the survey work and Sarah's work as it relates to the notable difference I mentioned before between renters and owners in rural areas and their health position and their perceived health, and whether they're in good health or not so much from their own perspective, which can be correlated together with pre-existing conditions and lead to bad outcomes in a pandemic, and also feeling more stressed, which is and for the renters to be connecting that to their housing situation is one that's really meaningful for us in the housing market. So I know that, Sarah, you mentioned that things to address these, there's affordability issues, there's home feature issues, there's neighborhood amenities. What can get at kind of helping renters out with these issues?
Sure. So the research is really telling us that it comes down to a combination of addressing each of those three features if we want to see lasting improvements made. So for some background on those three areas, we came up with those focuses based on the 5 social determinants of health. And we narrowed in on the areas that seem to be the most meaningful from a housing context. So as we were creating this study, we knew from existing literature that each area was important to the big picture. Of course, what we didn't know was how Americans, and particularly rural Americans here, would react to those themes in the context of their own housing and their own lives. And it turns out that they reacted rather strongly to all three. Very few rural Americans selected that there was no perceived impact between how their housing is impacting their health outcomes. And unfortunately, it was the same few demographic cohorts for each of those three areas who repeatedly tell us that affordability, their neighborhood, and their home are all contributing negatively to health outcomes. So those were renters, households earning comparatively lower incomes, Black Americans, and as we're talking about here, rural Americans. So any combination of those two groups, as we see with the rural renters, is of particular interest and possibly particular concern. So for those populations that are getting hit from all three areas of study, to really comprehensively help them from a health standpoint, we would need to address each pain point separately.
That makes sense. And always when there's an all of the above, right, you would expect that on complex issues like this. So, for the researchers in the crowd, I know that in Elizabeth's work, there was the looking at area median income and then health outcomes, and it was difficult to find a correlation there. Oftentimes, when that's the case, there's the question of, as a researcher, what would be a data point that would be especially helpful if I think that maybe there is something there, and sometimes surveys can fill that gap. But I don't know, Liz, do you have any ideas of if there were additional data points, what might be most useful?
Yeah, so when I was trying to think about what I could use to actually, compare with the COVID data, what I really wanted to do is try and get something that would capture the quality of the housing cost, or of the housing stock, excuse me. Because I really was interested in, okay, so I've got a little bit on residential crowding. There's a little bit on the amount that, how much of a housing burden it is in a county. But when I'm looking at these aggregate statistics, it's really difficult for me to know how good is the housing? Is it a little bit dilapidated? Are there a lot of pests? I know that the census does collect some information on plumbing and full kitchens and that type of thing, but that's, not something that can actually really be used at a national scale, because those are issues that still are important to specific parts of the country. So it's, something that would be a better idea of what is the overall characteristic of the housing in an area, whether it's owned housing or rented housing, would be really great if that's something like that existed. But honestly, the best data, which I don't think anybody will ever give me, what I would like would be to have information on people who whether they had COVID, whether they died from COVID, what kind of housing conditions they had, and all the information about race, ethnicity, background, all of that stuff. But so that I could do some sort of really cool, econometric regression where I can actually tease out causality. But that doesn't exist anywhere as far as I know. So that would be like the dream.
Right. It is useful, even when we know it's probably not available, to kind of do the thought exercise and to raise these things, and maybe we'll come across somebody who has ideas or even data for a case study or something that would lead to that. And certainly if it would contribute to, as you say, better information around kind of equitable housing together with these kind of issues, that would certainly be even optimal. And I will say that housing quality, from our own perspective, is always important as a debt investor, and because that can be important for debt performance, and it's also important, I think, as Lance brought up, I think it was earlier, that in rural areas it can be hard to maintain the housing stock, and it may become less well maintained, and having better data on that and doing a compare and contrast there would be fantastic. But with that said, I think we have time for just one last question. So thank you, everybody, for your participation today. I think that as we saw, I think both Liz and Lance, you illustrated that they moved around the country. They changed over time in the areas that they were in. So everybody was hit pretty much at some point or another, and maybe being hit again. Are there examples of things that rural areas did to kind of better prepare themselves for, and maybe be in a situation where they could handle the pandemic better? Lance, do you have any thoughts on that?
I do, but I would also say it's good that you asked Elizabeth the question about what data we need, because I could spend the rest of the afternoon on that question. I would quickly interject. While that I could spend a long time on that, the pulse data, which, some people have concerns about the pulse data, which is data that the Census Bureau puts out about how Americans are coping with COVID, that you cannot analyze that for rural communities. There are no rural specific data. So I would make a plea at the top of that list that the Census Bureau start producing rural data from the pulse data. So I will now go to the question that you actually asked me, Steve. I don't know if I have a great answer other than we at the Housing Assistance Council, as I've noted before, we don't build or develop housing. We work with hundreds of local community-based organizations that build, develop, preserve, maintain housing in their community. They know what's best for their community. We just try to help them. And there are some really, really great examples where we've tried to build up what we call our rural capacity building. And oftentimes these housing providers in these communities, sometimes they work in some of the poorest communities in the United States. And then secondly, they are, as I mentioned before, incredibly resourceful and have resilience and perseverance, right? These are characteristics of oftentimes aren't as well resourced communities or organizations that are trying to solve housing solutions in these areas, and they are incredibly resourceful. You would be amazed at what they can do with relatively modest resources. But there are a couple of examples that I would just mention, and I don't have time to go into detail. One is CASA of Oregon, which is an organization that really supports farm worker housing in the state of Oregon in the Pacific Northwest. And they, I think farm workers were finally given some attention during the early parts of the pandemic, knowing that they were essential workers, that food was essential in this nation, and that they were really the front line bringing food to American households. And they've done some really amazing work in helping advocate for and improve the housing conditions of farm workers. Similarly, in Central Appalachia, there's an organization called the Housing Development Alliance. These are communities that, again, struggled long before the pandemic, but they did an amazing job at business continuity and continuing the continuity of their housing services, particularly around one that we didn't think of, which was housing rehabilitation. Housing was often deemed essential in many communities across the nation during the pandemic, but housing rehabilitation is an entirely another avenue, because you have to oftentimes go into the house and fix it up. But many rural residents need those modifications and repairs to their houses. And they went through extraordinary efforts to continue and provide continuity to their services, to provide these much needed housing rehabilitation services. Very similar in the U.S.-Mexico border, in what we call the border colonies. You already heard from Zaraima today. They're doing amazing work. There's another organization called Proyecto Azteca that was also working, again, on this, I think, this kind of business continuity of trying to provide housing services. So I could literally talk about this for a long time, but I would say the larger narrative is that many of these community-based organizations that are the catalyst to make sure that housing gets to their community were amazing at business continuity. That's where I would say there was a huge success.
That sounds great. Thanks, Lance. And certainly it's always great to kind of end on a high note and think about the successes. So and the work that's done in these local areas is just a yeoman's labor, right, to get that kind of thing done. So that's fantastic. And so thanks everybody for attending today. I think it's we've learned a lot through these discussions. And but before we wrap for the day, I just want to turn it over to get a word from our chief economist here at Freddie Mac, Sam Cater. Sam.
Okay, good afternoon, and thank you to all the speakers, and thank you for joining. My name is Sam Cater. I'm Chief Economist at Freddie Mac, and I'd like to summarize the sessions that we heard today. First, in the Economic Outlook session, we learned about the changing geography of demand and how that will persist into rural areas, and that'll be an opportunity for rural markets, especially for improving the aging housing stock. However, this means that supply and affordability issues will be persistent challenges in rural areas, particularly with mortgage rates rising. That will make affordability more of a challenge. Rural challenges are also most acute for small builder financing, skilled labor, and materials, which disproportionately impact rural areas. And this is particularly important given that supply challenges are really becoming a main theme in many rural markets. We also learned about the different ways we can define rural America. I thought it was fascinating that we learned about the mosaic and the overlapping ways that rural is defined from a statistical and policy and perceptions point of view. And the choice of rural definition matters greatly for market sizing, but that directionally rural challenges remain similar irrespective of the sizing. But some of those differences in definitions can really have some magnitudinal differences. We also learned about the Southeast Crescent region and the challenges and the homeownership gaps in these areas that are very similar to Delta and Appalachia, and it leads to a dearth of financing opportunities in many of these high needs markets. And then lastly, we learned about the health and housing and impact on rural America, and we learned about tenure choice and the impact it has on perceptions of health for rural Americans, as well as the cost of housing, which has the highest impact on health. And this is particularly the case for rural residents because the majority of them struggle to pay for the basics on a day-to-day difference. And while much of the attention around COVID has been really on urban environments, COVID has had more of a negative impact in rural areas in terms of health and economic outcomes. And this is due to the older age of the population in rural markets and many of the underlying chronic health conditions, the closing of hospitals and the longer distance to ICUs and lack of health insurance in many of these rural markets relative to their metro counterparts. That wraps up today's program. Please join us back tomorrow where we will hear from our keynote speaker, Catherine Coleman Flowers, who will discuss environmental justice and sustainability. And we will have sessions on rural affordability and sustainability. And then we'll hear about some of the latest trends in manufactured housing. Thank you for joining us, and we'll see you tomorrow. Bye, everyone.